Before you turn 65, there are 5 silent risks quietly threatening your independence, your health, and your peace of mind. Most people ignore them because facing them feels uncomfortable, even painful. But the cost of avoiding them now is far greater than the courage it takes to act today. There's something about the number 65 that feels arbitrary, just another birthday. But in reality, 65 is a threshold, a line drawn in the sand by systems far bigger than any of us: healthcare, finance, law, and biology. Once you cross that line, the rules change in ways most people never see coming. At 65, Medicare begins. For many, that feels like relief. But Medicare is not comprehensive. Part A covers hospital stays. Part B covers doctor visits. Prescriptions? That's Part D, and it costs extra. Long-term care, dental, vision, hearing, not covered. And the supplemental insurance you'll need can only be purchased without medical underwriting during a narrow window around your 65th birthday. Miss that window, and you could be denied coverage. Your body changes, too. Decades of small choices have compounded. The occasional back pain, it's constant now. The slightly elevated blood sugar, it's prediabetes, or worse. Falls become more dangerous. Bones break more easily. And if you haven't built strength before this point, catching up becomes exponentially harder. Legally, 65 is when certain protections either activate or expire. If you haven't assigned power of attorney or created a healthcare proxy, you're leaving your fate in the hands of bureaucracy and family conflict. Social Security claiming decisions matter too. Claiming too early costs you permanently. Emotionally, this age is a reckoning. Retirement is no longer theoretical, and with it comes the question, who am I when I'm not working? Some people thrive. Others collapse inward when the structure disappears. So when we say 65 is a threshold, we mean it, literally. It's the point where preparation meets consequence. The decisions you make now determine how much freedom and dignity you'll have on the other side. You can't undo neglect once you've crossed over. What you can do is act now, while you still have time. The first silent risk lives inside your body, and it's been growing quietly for years. You don't feel it. You don't see it. And unless you've specifically asked your doctor to check for it, you probably don't even know it's there. It's called bone density loss, osteoporosis in its advanced form, and it's one of the most underdiagnosed conditions in people approaching 65, especially women, but men are not immune. Here's what happens. Starting in your 30s and 40s, your bones begin to lose density. Slowly at first, so slowly you'd never notice. But by the time you reach your 60s, that loss has accumulated. Your bones become porous, fragile, brittle. And the danger isn't the condition itself. It's what the condition allows. A minor fall that would have bruised you at 45 fractures your hip at 68. A stumble off a curb breaks your wrist. A sudden movement cracks a vertebrae in your spine. And each of those injuries doesn't just hurt. They steal your independence. A hip fracture after 65 is catastrophic, not because it can't heal, but because of what it triggers: hospitalization, surgery, immobility. And immobility in older adults leads to muscle loss, blood clots, pneumonia, and cognitive decline. Studies show that nearly 30% of people over 65 who fracture a hip die within a year, not from the fracture itself, but from the cascade of complications that follow. Those who survive often never return to independent living. They move from hospital to rehab to assisted living, and they never go home. And the cruelest part? This is preventable. Bone density can be measured with a simple, non-invasive scan called a DEXA scan. It takes 10 minutes, it doesn't hurt, and it tells you exactly where you stand. But most doctors don't order it unless you ask. It's not part of the standard annual checkup. So people walk around with bones like chalk, never knowing, until the day they fall. If you haven't had a DEXA scan, you need one. If your results show low bone density, there are medications, supplements, and weight-bearing exercises that can slow or even reverse the loss. Calcium and vitamin D aren't just suggestions. They're foundational. Resistance training isn't optional, it's medicine. And if your doctor dismisses your concern or tells you to wait, push back. This is your skeleton. This is your mobility. This is the difference between living independently at 75 and being bedridden. But bone density is only part of the picture. The second silent risk is equally invisible, and it's happening in your blood. High blood pressure, hypertension, the silent killer they call it, and they're not exaggerating. You can have dangerously high blood pressure for years and feel absolutely fine. No symptoms. No pain, no warning. Until the day your heart gives out, or a stroke leaves you paralyzed, or your kidneys fail. Here's what most people don't realize. Your blood pressure in your 60s is not the same as it was in your 40s. It creeps up slowly. Stress, diet, weight gain, reduced activity, all of it pushes those numbers higher. And once you're past 60, even moderately elevated blood pressure becomes a serious threat. A reading of 140 over 90 might not sound dangerous, but sustained over months and years, it damages your arteries, your heart, your brain. It's like running your car engine in the red zone every day. It'll run for a while, but eventually something breaks, and the damage is cumulative. Every month you spend with untreated high blood pressure is a month your body is under siege. Your heart works harder. Your arteries stiffen. Your risk of dementia increases. Because, yes, hypertension doesn't just threaten your heart, it threatens your mind. Reduced blood flow to the brain accelerates cognitive decline. The very thing you fear most, losing your memory, your sharpness, yourself, is being fed by a condition you could control right now. If you don't own a home blood pressure monitor, get one. They cost less than $50. Check your pressure weekly, know your numbers, and if they're high, don't wait for your next doctor's appointment. Call now. Medication exists. Lifestyle changes work, but only if you act before the damage becomes permanent. These two risks, fragile bones and high blood pressure, are silent because they don't announce themselves. They don't wake you up at night. They don't stop you from living your day. But they're there, working quietly in the background, setting the stage for the crisis. And the window to address them is closing. Not because you're running out of time to live, but because you're running out of time to prevent what's coming. That's the difference. And that's why this matters now. The third silent risk isn't in your body. It's in your life. And it's far more dangerous than most people realize. It's isolation, loneliness, the slow, quiet withdrawal from the relationships that once gave your days meaning. And if you think this doesn't apply to you because you're still social, still active, still married, think again. Because the isolation that threatens people over 65 isn't about being alone. It's about being disconnected. You can be married for 40 years and still be lonely. You can live in a house full of people and still feel invisible. You can have 100 acquaintances and not a single person who truly knows you. And as you approach 65 as retirement looms, as your daily routines dissolve, the relationships you've been coasting on, the work friendships, the casual connections, the surface-level social interactions, they disappear. And what's left is the truth. How deep are your bonds, really? Research shows that loneliness after 65 is as deadly as smoking 15 cigarettes a day. It increases your risk of heart disease, stroke, dementia, and early death. But it's not just the physical toll. It's the emotional unraveling. When you have no one to talk to, no one who checks on you, no one who notices when you're struggling, you stop reaching out. You stop trying. You convince yourself that you're fine, that you don't need people, that independence means doing everything alone, and slowly, quietly, you fade. The relationship you're neglecting right now, the one you need to repair or deepen before 65, might be with your spouse. You've spent decades building a life together, but have you built a friendship? Do you talk about things that matter, or just logistics? Do you know each other's fears, dreams, regrets? Because retirement will put you in the same house all day, every day, and if you don't genuinely enjoy each other's company, that proximity becomes suffocating. Resentment builds, silence fills the rooms, and what was supposed to be your golden years becomes a cold war. Or maybe it's your children. You raised them, supported them, loved them, but do they really know you? Have you let them see your vulnerability, your humanity? Or have you stayed in the role of parent, strong and unshakable, even as you've started to need them? Because the time is coming when you will need them. And if you haven't built a relationship where they feel comfortable caring for you, where you feel comfortable receiving that care, those moments will be filled with tension and pain instead of grace. Or maybe it's your friends, the people you used to see all the time but somehow drifted away from. Life got busy, careers took over, and now it's been months or years since you really connected. You tell yourself you'll call them soon, you'll make plans, but soon never comes. And before you know it, the people who once knew you best are strangers, and you're alone in a crowd of memories. Here's the hard truth. You cannot build deep relationships after a crisis hits. You cannot forge intimacy when you're desperate. If you wait until you're sick or scared or grieving to reach out, people will help, but it won't be the same. Real connection is built in the ordinary moments, the regular check-ins, the honest conversations, the willingness to be vulnerable before you have to be. So if there's someone you've been meaning to call them today. If there's a relationship that's fractured, begin the repair, even if it's uncomfortable, even if you have to apologize, even if your pride fights you. Because the cost of pride after 65 is isolation, and isolation kills. The fourth silent risk is financial, and it's the one nobody wants to talk about because it requires admitting something painful. You might not have enough. You've worked your whole life. You've saved what you could. You've planned, or at least you think you have. But the math doesn't lie, and the assumptions most people make before 65 are dangerously optimistic. You assume Medicare will cover your health care? It won't. Not completely. You assume Social Security will be enough to live on. For most people, it's not. You assume your savings will last. But have you actually calculated how long? Have you factored in inflation, market downturns, unexpected expenses, the cost of long-term care, or are you just hoping it works out? The average cost of a private room in a nursing home is over $9,000 a month. Medicare doesn't cover that. Medicaid might, but only after you've spent down almost everything you own. And if you need memory care, add another $2,000 a month. If you need it for 5 years, and many people do, that's over $500,000. Do you have $500,000 set aside for care? Most people don't, and most people don't realize the gap until it's too late. Long-term care insurance could help, but only if you buy it before you need it, ideally in your 50s or early 60s. After 65, it becomes prohibitively expensive or impossible to get. So if you don't have it now and you haven't planned for care costs another way, you're gambling with your future and your family's inheritance. Then there's the mistake of claiming Social Security too early. You can start benefits at 62, but for every year you claim before your full retirement age, you lose a percentage permanently. Claim at 62 instead of 67, and you're looking at a 30% reduction for the rest of your life. That might not sound like much now, but when you're 80 and living on a fixed income, that difference is the difference between dignity and desperation. And here's the conversation nobody wants to have. You might need to downsize. You might need to sell the house you've lived in for 30 years, not because you want to, but because maintaining it, property taxes, repairs, utilities, upkeep, is quietly draining resources you'll need later. The emotional attachment is real. The memories are precious. But the house is not your family. The house is not your identity. And if keeping it means running out of money at 78, it's not worth it. This is the risk that requires the most courage to face, because it means looking clearly at your numbers and accepting what they tell you. It means having hard conversations with your spouse, your financial advisor, maybe even your kids. It means making sacrifices now to protect your future self. But avoiding it doesn't make it go away. It just makes the reckoning more brutal when it comes. The fifth silent risk is legal, and it's the one that will cause the most pain to the people you love if you don't address it. It's the absence of an advance directive, a healthcare proxy, a living will, a durable power of attorney. These aren't just documents. They're your voice when you can no longer speak. And without them, your family will be left guessing, arguing, and suffering. Imagine this. You have a stroke. You're in the ICU, unconscious, on life support. The doctors say there's no meaningful chance of recovery. Your spouse wants to let you go peacefully. Your daughter insists on keeping you alive. Your son doesn't know what to do. Nobody knows what you would have wanted because you never told them, so they fight in the hospital hallway, in front of doctors, while you lie there, caught in the middle of their grief and confusion. Or imagine you develop dementia. You can no longer make decisions about your care, your money, your home. But you never assigned power of attorney, so your family has to go to court, hire lawyers, prove you're incapacitated, and petition for guardianship. It takes months. It costs thousands of dollars, and it's humiliating for you and for them. These documents are not about death. They're about clarity. They're about mercy. They're about sparing your family the agony of making impossible decisions in the worst moments of their lives. And they're simple to create. You don't need an expensive lawyer. You can download forms online. Fill them out, get them notarized, and give copies to your family and your doctor. It takes an afternoon, but people don't do it. They avoid it because it feels morbid, because thinking about incapacity or death is uncomfortable, because they tell themselves they have time, but you don't know that. None of us do. And the cost of waiting is not borne by you. It's borne by the people who love you, who will have to navigate your crisis without a map. So this week, create these documents. Sit down with your spouse or your most trusted person and tell them what you want. If your heart stops, do you want CPR? If you're in a vegetative state, do you want to be kept on machines? Who do you trust to make medical decisions if you can't? Who do you trust with your finances? Say it out loud. Write it down. Make it legal. This is not giving up. This is taking control. We've walked through 5 silent risks: the bone density and blood pressure you're not monitoring, the relationship you're neglecting, the financial blind spot that will hurt you, and the legal documents you haven't signed. Each one is uncomfortable to face. Each one requires action that feels hard or painful or frightening, and that's exactly why most people avoid them. But here's what you need to understand. The discomfort you feel now is nothing compared to the suffering that comes from ignoring these risks. The awkwardness of calling an old friend is nothing compared to the loneliness of having no one. The inconvenience of a doctor's appointment is nothing compared to a hip fracture that ends your independence. The difficulty of financial planning is nothing compared to running out of money at 80. The unease of talking about death is nothing compared to leaving your family in chaos. Courage is not the absence of fear. It's action in spite of it. And right now, you have the opportunity to act. You're not in crisis yet. You're not desperate yet. You still have choices, time, and control, but that window is closing, not because of age itself, but because these risks compound. They grow quietly, and then all at once, they overwhelm you. So this week, not next month, not someday, this week, do one thing. Schedule the DEXA scan. Buy the blood pressure monitor. Call the friend. Talk to the financial advisor. Create the advanced directive. Pick one. Start there. Because the first step breaks the paralysis. The first step proves to yourself that you're not helpless, that you're not in denial, that you're someone who faces hard things with dignity. Your future self is counting on you, the person you'll be at 70, at 75, at 80. They're depending on the choices you make right now, and they're hoping you'll be brave enough to protect them even when it hurts.